The vast majority of the Achilles injuries we see are more from what we refer to as the weekend warrior type of people. People, usually a young teenager, early 20s, it's pretty unusual to rupture your Achilles. It's more as we get a little bit older, the people who aren't real active during the week and then on the weekend try to go out and do sports. Those are the people who we tend to see. And it's a pretty classic, you can diagnose an Achilles tendon injury pretty much over the telephone. It's pretty incredible. What people will talk about, the type of things that they're doing when they rupture it. They could be playing softball and they go to hit the ball, or they're playing tennis and they go to hit a shot. They just go to push off and they'll feel a snap or pop, and people can actually hear it who are near them. People will describe that they thought that someone hit them in the back of the leg with a tennis racket or a bat or something, and they drop down. And it's pretty uncomfortable. But then, usually after a day or so, a lot of times they can walk on it, and many times people don't come in right away with the Achilles tendon injuries because they think that they're getting better. And sometimes they won't come in for about a month, 6 weeks, and the complaint then is that they just feel weak in their leg. So you don't rupture your Achilles and get up and keep playing tennis. You hobble off of the court, you hobble off of the field,
Right.
and you're pretty uncomfortable. Well, they won't return to things like tennis or playing softball. What happens is they'll go to bed, they'll get up the next day, and it's pretty sore, and they think, well, maybe I just sprained it, it'll get better. And it actually starts to feel a little bit better, and they can then start losing the limp, and they think they're getting better, and they are a little better, and then they just realize that if they try to run, if they try to get back to playing tennis, they just don't have that push-off ability because the tendon is torn.